Hi, my name is Sophia and I'm a level 1 nursing student. I'm here to ask you a couple questions in regards to your patient and if I could possibly shadow you today, if that's okay.
Yes, that's fine. My name's Michelle. We're going to be taking care of Mr. Ronald Jarvis today. He's a 67-year-old male, 171 pounds. He's 5 foot 11 inches. He has no known allergies. He's a full code. He came in with a stage 2 diabetic ulcer on his right heel, which he says isn't healing. He noticed it 3 weeks ago. He has tried to soak it in salt water to try to relieve the pain, but it hasn't worked. He's also here for his diabetes. He's a type 1 diabetic, and all the way up until about 5 days ago, he had it pretty well controlled, but lately it's been elevated into the 300s, so we're going to try to figure out what's going on with that. He's alert and oriented ×4. He does have deficits in the pinprick sensation to his bilateral lower extremities, and of course the increased pain to his right heel because of the ulcer. He also reports tingling in both of his legs, which has worsened in the last 3 months. He's on an 1,800 calorie ADA diet with a 2 gram sodium restriction. We are ordered to check his blood glucose levels before meals and at bedtime. At home, he says he's following the 1,800 ADA diet, but he's been non-compliant for the past 9 months, so he's requesting a little bit of education on that. His last vitals were at 445, his respirations were 16, his heart rate was 76, he's on room air with O2 sats at 96%, and his last blood pressure was 128/70. His last AccuCheck was 242, and that was at 8:30 p.m. All of his labs that were ordered were normal except for his fasting blood sugar, which was elevated to 310. And also his ALT, but that was only elevated slightly because of his age. That's expected. So right now, what we're doing for his ulcer is we're waiting for wound care to come through and visit him. So we're just waiting on that consult to go through. But for now, we have orders to clean and irrigate the wound with normal saline and cover with clean, dry, sterile dressing 2 times a day until they come evaluate him. He has a few medications. He's on morphine, 4 milligrams IV every 4 hours as needed for pain. He's on aspirin 81 milligrams by mouth daily. He's on simvastatin 20 milligrams by mouth daily in the evening, lisinopril 10 milligrams by mouth daily, gabapentin 600 milligrams by mouth 3 times a day. And of course his 2 insulins, his Lantus, which is 18 units sub-Q, once daily at bedtime, and then his regular insulin, which is 4 times a day, and the dosing is as per sliding scale. So right now he's due for both of his insulins. His last blood glucose was 242, so we'll be giving him 16 units of the regular and 18 units of his glargine.
Okay. Why specifically is this client receiving this medication?
Well, Mr. Jarvis is a type 1 insulin-dependent diabetic. He has been for 20 years, and his body just doesn't produce insulin like it should anymore. So we need to provide it for him to make sure that his blood glucose remains stable.
When should you question administering this medication? Does the medication have a therapeutic serum level, and which vital signs need to be monitored?
We always need to monitor all vital signs, but more specifically with him, we need to closely monitor his blood sugar. I would question administering this medication if I knew that his blood glucose levels were too low to bring him to an unsafe level.
What interventions must be thought to the client to ensure the medication is administered safely at the hospital and at home?
In the hospital, we're the ones that are administering the medication for him, but he does need to know to adhere to his diet so that the insulin works properly. At home, he needs to do that still, but he also needs to understand that he shouldn't be sharing his needles, he shouldn't be reusing them, he needs to change them out each time. He needs to dispose of them properly into a Sharps container. He needs to know to rotate his injection sites. And
What are the side effects and potential adverse reactions?
Obviously, a decrease in his blood sugar levels would be hypoglycemia would be the most common. He can also experience redness and swelling at his injection site or anaphylaxis.
Okay. How will you know the medication is effective?
If when we administer it that his blood sugar is maintained at the normal levels, then we'll know.
Okay. Thank you.
You're very welcome. So we're just going to go in the room and administer Mr. Jarvis's 2 medications. Knock, knock. How are you doing, Mr. Jarvis?
I'm well, thank you.
That's good. My name's Michelle. I'm a nurse, and this is Sophia. She's a student nurse. She's going to be shadowing me today. Would it be okay if she observed?
Yes.
Okay. So we're here to give you your insulin. So I'm just going to verify your name and date of birth. Could you state that for me?
Ronald Jarvis, 67 years old.
Thank you very much. And do you have any allergies?
No.
Okay. All right. Thank you. So I'm going to scan his armband. And I'm going to pull up his profile here. I'm just going to double check that I have the right patient. I have his date of birth. I have the room. It shows that he has no allergies here. Okay. Now it shows what medications are due. So we have the regular insulin, and we also have the Glargine. So I'm going to go grab those. Excuse me. So first I'm going to wash my hands and put my gloves on. When I'm pulling the medication out of the Pyxis, I'm going to verify that I have the right medication. I'm going to verify that I have the right doses and that I'm going to be administering in the right route. I'm going to inspect both bottles for integrity and make sure they're not cracked or broken in any way. I'm going to make sure that the consistency is normal, and it is. Expiration date is okay. So Mr. Jarvis, where was the last area that you received your injections?
On the right lower abdomen.
Okay, is there a specific place that you would like to receive both of them today? We have 2 for you.
I can go ahead and get it on the left side this time.
Left side, okay, so 1 lower left and 1 upper left. Is that okay?
Yes.
Perfect. Okay. So I'm going to do the regular insulin first, which we're going to be giving 16 units, and that's per sliding scale because his blood sugar was at 242, and that's what's ordered for that level. Okay. So I'm going to open my syringe. And I made sure that when I scanned the insulin, I got a green light, so it shows that the medication is okay to give right now. Okay. So first, this is the normal insulin. I'm going to clean the top off. Take the cap off of the syringe. Okay, so we're giving 16 units of the regular insulin. So first thing you have to do is pull up 16 units of air and then instill it into the vial to displace, and then invert it, and then pull up the 16 units of insulin. We're going to recap without touching it with your other hand, like that. Now, get that out of the way. The second one is the Glargine, and same thing. We're going to clean off the top here, open our syringe, and this one is due at bedtime every night, but we're giving 18 units of insulin. Cap off. I'm going to pull up 18 units of air. Instill that air into the bottle. Invert and pull up the 18 units of insulin. And recap with one hand. Okay, Mr. Jarvis, are you ready?
Yeah.
All right. So, I've already scanned his bracelet and verified his name, date of birth, and everything, and allergies. So, he said the left side, one on the upper abdomen, one on the lower. So, I'm going to use the upper abdomen first, just clean the area, make sure it dries, dispose of that. First, we're going to inject the normal insulin. Going to hold the syringe at 90 degrees and gently pinch the skin to stabilize it. Make sure I'm 2 inches away from the belly button. And inject slowly and hold for 5 seconds. Pull out. I'm going to dispose of the needle without recapping. How you feeling, Mr. Jarvis?
Okay.
Good. I got one more for you. So, this is the Glargine. Just going to clean off the site here, make sure it dries. Stabilize the skin, 90 degrees, 2 inches away from the belly button. Hold for 5 seconds. And we're good. Still feeling okay?
Mm-hmm.
All right. Can you tell me how you would normally administer your own insulin at home?
I would go ahead and just make sure that I'm looking at the right unit and that it's the right medication, and before I go ahead and inject myself, make sure that I'm not using the same needles twice, and that I discard, and that I rotate the injection sites.
Good job. Do you know the signs of hypoglycemia just in case?
Confusion, sweatiness.
Good job. And so, I hear that you're requesting information on your diet, correct?
Yes.
Okay, perfect. I have a pamphlet for you. This should have everything that you need in here to make sure that you're making good choices, to make sure that your blood sugar stays stable. So I'm going to leave this with you.
Okay, thank you.
You're welcome. And if you have any questions at all, just let me know. And if need be, we can always get the dietitian in here to come talk with you if you need more information, okay?
Okay, thanks.
You're very welcome. I'm going to leave your call light right here next to you. Is this an okay spot?
Yes, that's fine.
Okay, perfect. Thank you so much, Mr. Jarvis. And let me know if you have any more questions or concerns, okay?
Okay.
Okay, thank you. So I'm going to come back over here to my computer. And I'm going to wash my hands first. And then I am going to document. The first thing I'm going to document is the location of the injection sites that we used. I'm going to document how the patient tolerated the procedure. I'm going to document that I provided teaching regarding his insulin injections at home, make sure he knows how to do that, make sure he's aware of all the signs of hypoglycemia, and also his diet, like he requested. Okay, and after I'm done doing that, I'm going to go out and I'm going to hit save.
Okay. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, we reviewed the blood glucose levels because if they would have been too low, we would have most likely withheld them so that we would not put him into a hypoglycemic state.
Okay. Did this information affect your decision to administer the medication?
Yes, because like I said, if it were too low, we would have held the medication.
Did this information affect how you administer the medication?
Yes, when I was in there, I asked Mr. Jarvis where he last received his injections, and being that he told me where, I was able to choose a different site because by choosing a different site, it helps the absorption of the medication, and it helps provide him less discomfort.
Okay, thank you.
You're very welcome. Thank you.